Most people only give their stomach a second thought when we've filled it to excess. Yet did you know that stomach cancer is one of the most common cancers worldwide? It is seen less often in the United States, with fresh food being more accessible. However, the impact and challenges of life post-stomach cancer are significant. I'm Catherine. Welcome to the Inspired Vitality Show. In this video, I'm going to give you an overview of stomach cancer, including the risk factors and the symptoms. And then I'm going to give some concrete assistance for those who have been diagnosed with stomach cancer by highlighting two organizations and sharing how they can support the patient and the family. Stomach cancer is also called gastric cancer, and I'm going to use these two words interchangeably throughout the video. Before it develops, precancerous changes often occur in the lining of the stomach, but rarely cause symptoms and can go undetected. The cancer cells then usually begin on the inner lining of the stomach walls and tend to develop slowly over many years before penetrating deeper into the stomach walls as the cancer develops. The tumor may grow to involve nearby organs like the liver and the pancreas. There is much cause for hope if gastric cancer is found early. However, the outlook is poor if discovered at an advanced stage. Risk factors that can increase a person's chance of getting stomach cancer include family history, smoking, obesity, a diet that's high in salt, and a diet that does not include many fruits and vegetables. So what are the symptoms of stomach cancer? They can include nausea and vomiting, difficulty swallowing, heartburn or indigestion, loss of appetite, perhaps weight loss, feeling tired, feeling bloated, or feeling full after eating just a small amount of food. If you have been diagnosed with stomach cancer, I've done some research for you, and I want to highlight the resources available with the Gastric Cancer Foundation and No Stomach for Cancer. The Gastric Cancer Foundation was established to provide information and an understanding community for people with gastric cancer and their loved ones. They have resources, an online community, and a great download that I'll talk about in just a minute. Their mission is to find a cure for gastric cancer. Now, about that free download from the Gastric Cancer Foundation. It provides and organizes important information needed by patients in order to make informed healthcare decisions. You can download and complete your treatment and survivorship care plan using the template. What I really love about it is that it includes a glossary of GI terms. And some of the terms are actually in alignment with other cancers, and some are specific to GI cancer. In my experience, it's really helpful to get to know the terms used in the medical community when you have a new diagnosis. So be sure to take advantage of that resource if you need it. While it may be difficult to eat, nutrition is an important part of gastric cancer treatment and recovery. A balanced diet with the right amount of calories, protein, vitamins, and minerals is an important part to maintaining your strength and to heal. The Gastric Cancer Foundation offers nutrition tips, and it has a video series with cooking demonstrations to support the healing process that are by a chef and a gastric cancer survivor. No Stomach for Cancer is a nonprofit patient advocacy organization that advances awareness and education about stomach cancer. They invite you to explore their library of resources as they strive to help advance awareness and education about stomach cancer. They also provide support network for affected families and support research for screening, early detection, treatment, and prevention of stomach cancer. They offer one-to-one support, and on their website, they have a chart that lists foods that are better or less tolerated by people following A gastrectomy, which is the surgical removal of a part or whole of the stomach. The stomach serves as a reservoir to hold food and allows it to gradually enter the intestine. Up to 75% of patients who have had a partial or total gastrectomy may experience what's called dumping syndrome. In short, it refers to food being dumped too quickly into the bowel, and it can lead to a number of uncomfortable symptoms. The better tolerated and less tolerated chart by No Stomach for Cancer gives patients a list of the foods that are less likely to cause dumping syndrome than the foods which are known to cause dumping syndrome in some people. It can take time and experimentation to figure out what works best for each person. It is recommended to keep a food journal to track the time of day, food intake, including quantity and symptoms when they occur, to assist in identifying problem foods and habits. The No Stomach for Cancer also has a sample meal plan chart, which might be very helpful to some people. If you have been diagnosed with stomach cancer, be sure to take advantage of the resources from Gastric Cancer Foundation and No Stomach for Cancer to make your life a bit easier. Let me know in the comments if this video has been helpful. See you soon.